everybody. It's Dr. Marissa Tenenbaum from West County Plastic Surgeons, and I am here today with our lovely licensed esthetician, Jennifer McGoogan.
Hello.
And we are going to talk to you today about a bunch of non-surgical stuff that you can do to help your skin in particular look its best year-round, but particularly with the upcoming holidays. We would love to answer any of your questions, but we are going to kind of speak about overall skincare as well as some treatments you can do in the office to maybe get ready for the holidays. So, Jen, what is your favorite treatment bundle for people who are maybe looking for not as much downtime, but trying to look really good for the upcoming holidays?
So my favorite two treatments would be the HydraFacial with the microneedling. Microneedling, minimal downtime. Maybe give yourself a couple days, 2 or 3 days to heal, but you're going to see a really nice change in your skin, and then pair that up with a HydraFacial a week or two later is beautiful.
Okay, so can you tell everybody, if I haven't before, maybe I've told you before on here, but you didn't watch that one. So tell everyone, what is microneedling?
So microneedling is a collagen-inducing treatment. It's going to help soften fine lines and pigmentation, pores, and overall texture. And You'll have a really beautiful glow.
Yes. I will say, personally, that's my favorite treatment.
It's mine too, actually.
Yeah.
It's one of my favorites. So.
And as she mentioned, a couple of days of downtime. I think that's actually being generous. I actually think that a lot of people, it really depends on how you define downtime. Really, all you're going to have is a little bit of redness, maybe that day and the next day, and then a little bit of peeling. Most people, it's not horrible. I mean, certainly you wouldn't want to do it right before an event,
right.
But you can go to work the next day. It's not like you need to take a day off of work or anything like that. You're just going to look like you've got a little bit of a sunburn or a windburn and then a little bit of peeling, but you can certainly work.
Absolutely. And wear makeup too. A lot of people ask that question. Of course, you can wear makeup.
Hi, Holly. She thinks you look good.
Oh, thanks, Holly.
Okay, and what is a HydraFacial?
HydraFacial is a 3-step facial. I love it paired with the dermaplane because you're going to get rid of all the dead skin.
What is dermaplane?
Okay, so dermaplane is an amazing treatment just to get rid of all the vellus hair off your face and dead skin.
Yeah.
So it's a really great way to start a HydraFacial because then you'll go into the next step, which would be the exfoliation, the light peel, which no downtime, an event peel, basically extractions, and then you just infuse hydration, peptides into your skin.
Yeah.
So it's great.
The HydraFacial is amazing because it's pretty quick. It doesn't take forever. So you can get in and out of here with not a lot of time away from your life, and you will leave with this beautiful glowing skin. And like Jen said, it does include a peel, but it exfoliates you at the same time, and so there's no downtime at all. It's not like the peel where you get red and then you flake and you peel for days. It's not at all like that. You really have this glow immediately. You can go out that night or whatever, but you look amazing. And so she already mentioned that that's her two favorites. So I would echo that combination. Actually, those three things are my absolute favorite. So with the first step being getting a microneedling, I like to add PRP to that microneedling. And then about a week later or so, do a dermaplane with a HydraFacial. I just think it's the best. And again, very minimal downtime with all of those things. So if you had a party or an event that you wanted to look great for, I would do that like a couple weeks before and you'll be fantastic. Or even honestly, you could do a week before and then do the HydraFacial with the dermaplaning like 2 days before and you'll look great.
It's a perfect combo.
Yeah, absolutely.
And there's plenty of time before the holidays to get this done.
Absolutely. Okay, so what if somebody has a bit more downtime? What are some of your favorite like peels or laser treatments for somebody who can afford a bit more downtime?
So for a little bit of more downtime, the VI peel. Another one of my favorite combos would be doing a VI peel, doing a microneedling a couple weeks later, and then doing another peel. because you're going to see a really, really beautiful change in your pigmentation.
Yeah, so the VI peel, explain my understanding about the VI peels. It is a more aggressive chemical peel that we do in the office, and it's particularly helpful for patients or folks who have pigment issues like sun damage, brown spots, and that sort of thing.
Yeah. And it's great for melasma. So
yeah, I was just
really
going to say, what about the difference between sun damage and melasma?
So melasma is going to be patches all over the face, where sun damage is more localized, where you can almost treat with the laser and spot treat the sun damage and then come in for a VI peel, because the VI peel is going to really help the general lightness of the pigmentation.
Yeah.
So
great.
Yeah.
What about, so these are treatments that really help with some of the fine lines and the texture and pigment. What about skin laxity, like tightening the skin?
All therapy. My favorite. One of my favorites. That is just going to help induce collagen, create more collagen and skin tightening. So.
Yeah. So all therapy is also something we do in the office. You're awake for the treatment. It hurts a little bit more than some of the other treatments, and so we offer laughing gas, or sometimes people might even want to take a pain pill. Most people don't, but you can. But the laughing gas can really help. And the alt therapy is an ultrasound based system. And what the ultrasound does to the skin is, through a vibration technology, it induces, it's basically controlled injury of the deeper layers of the skin, which in turn induces collagen. So alt therapy, unlike some of these other treatments, it's not an immediate result. It's more of a treatment that you're going to see a result months down the road. So you do the treatment, and then your body, as it's healing the deeper layers, induces that collagen and that thickening of the skin, which can induce some skin tightening. And where do we use it?
So full face, neck, décolleté.
Yeah, absolutely. It's great for all those things. And for areas on the face like the brow, I even can do a little bit of a brow lift, because when you tighten the skin, it's lifting your brow a little bit. Under eyes, low face, jowling, neck, and then, like she said, people who get the lines or the creases in the décolleté area, can really help induce thicker collagen in that area to make it look smoother. Okay, what about body treatments that are not, for me, not surgical stuff? What about non-surgical body treatments?
Coolsculpting. Really for those stubborn areas of fat that's just, you can't get off in the gym. No matter how much you diet, exercise, you still have them. Coolsculpting.
Yeah, so Coolsculpting is great. We have talked a little bit about body contouring and liposuction. I believe Dr. McCatton did a video on liposuction that you guys can look. Liposuction for areas of stubborn fat as well. It decreases fat in an area. It doesn't really tighten the skin or get rid of excess skin, but it decreases the fat. Coolsculpting is very similar in that it's going to treat excess fat and decrease the amount of fat in a region. But the nice thing about Coolsculpting compared to liposuction is that it is not surgery. You're wide awake. There's no incisions. There's no scars. There's not even any injections. It's an external treatment that kills fat cells slowly over time. Cells go through what's called a programmed cell death, meaning over time, those cells will destroy themselves and your body will naturally eliminate them. And so what you're left with is fewer fat cells in that area that you've treated. Again, so not an instant result. It's going to be a result that people see over the course of several months. And most people require more than one treatment. So it's important for one of us to evaluate you and discuss with you how many treatments we think you're going to need and how we want to space those apart. But even if it's multiple treatments spaced apart, there no downtime. You can work out, you can go back to work, whatever it is. You just sit in the office. You can be on your laptop, your iPad, your phone, whatever you want to do during the treatment, and then you go right back to work. And so for somebody who is less patient, liposuction might be a better answer because it's kind of a one-time deal, but a little bit more downtime associated with that. For somebody who is more patient, willing to wait a few months for their results and wants the benefit of no downtime, Coolsculpting is amazing. And we use it all over the body.
All over.
All over. So necks, abdomens, arms, love handles, bra rolls,
Right.
thighs, inner and outer thighs, knees, all of those areas.
Yes, even this little area here, we get this area.
Yeah.
So that's, yeah.
So all of those are really successfully treated with Coolsculpting. Let's see. Let's go back a little bit. Let's talk about general skincare. I know that skincare for everybody is going to be a really tailored approach depending on your age, the age of your skin, the amount of damage in your skin, your DNA, basically, kind of what you were born with and what you've done to your skin over time. So that being said, what are some takeaway points that most people can use with regard to their skincare?
So as far as skincare, and it is like, I do a lot of customizing skincare plans, but depending on your concern, always a vitamin C or an antioxidant. So if you're not on either one of those, you should be on those. A sunscreen for sure, and a retinol at night.
Okay.
Or a retin-A or tretinoin cream.
Yeah. So a lot of people ask what sunscreen they should be using. Can I, a lot of people, can I just use my Neutrogena from Walgreens? What sunscreen should I be using? It doesn't matter.
Well, it does.
Yeah.
It does definitely matter what you're putting on your skin. And a lot of the over-the-counter products have fillers in them. So we always recommend at least a 30 SPF on your face at all times.
And for most people, some kind of what we call physical sunblock as opposed to a chemical sunblock is going to be better, especially if you have more sensitive skin. It's going to be a lot better. And then a lot of it also is how it works with your skin, because if it's something that you don't like, then you're not going to use it. So you want to find something that goes on your skin really elegantly and looks good under your makeup, or whether or not, or no makeup if you want to not wear makeup, so that you'll actually be compliant with it and wear it.
Right. And a lot of times patients don't like wearing sunscreen because they feel like it's irritating. It's the chemicals that are irritating the skin. So
switch to a physical blocker.
Yes.
Okay, let's see. What about eye creams? I feel like women, especially women, always want to know, what is the best eye cream? What does eye cream do for them? When should they start using eye cream and that sort of thing?
So as far as eye cream, I always say it's so much easier to prevent than to correct. So if you're showing signs of aging now, get on an eye cream. And it's going to help with, the one that we carry by Elastin, it's going to help with puffiness, fine lines and wrinkles, and hydrating the eye area.
Absolutely. Eye creams are your friend. Okay, so I wanted to also quickly point out that it's the holiday season. So at West County Plastic Surgeons, we do have some really, really incredible holiday promotions and deals right now that hopefully some of you can take advantage of. Jen mentioned Ultherapy, skin tightening, brow, face, neck, décolleté can be used in all of those places or one of those places, wherever your problem area is. We have a really good deal on a full face and neck Ultherapy treatment. So a discounted price on that. And then also combining an Ultherapy treatment with 3 sessions of microneedling. So the combination of the two is not only going to tighten skin, because microneedling does also do some skin tightening. So it's going to, the combination is going to really give you a great skin tightening, but then also the microneedling is going to kick in and improve the texture, fine lines, and pigment issues. So that combo of microneedling plus Ultherapy is really an amazing, amazing deal. We also have a great special on Coolsculpting package. Everybody buys a package because, again, almost nobody is going to be a single treatment. You're just going to be wasting your money. So we talked to you about the size of the package that we think you should buy. So we have a really good price right now on packages of 7 and packages of 12. So hopefully some of you can take advantage of that. And then today we didn't talk about fillers. We talked about fillers, I think, last week. But fillers, we also have some really good specials on fillers. So basically, the more syringes of filler you buy, the more discounted price you get. So the more value you get for your money. So we hope that some of you can take advantage of that. We are also, Jen mentioned very briefly, I don't know if you even heard her mention it, Elastin Eye Cream. But Elastin has an entire line of skincare, and We love Elastin products here at West County Plastic Surgeons. We like other lines as well, but we are just in love with Elastin. And right now, if you purchase any 2 Elastin skincare products, you will get a free gift of a Elastin retinol product. And I use the Elastin retinol product every single night. And then in the morning, I use my face cream and my eye cream and my neck cream. And so that's a super simple regimen that really almost anyone from any age can benefit from, even really young women who are not showing a lot of signs of aging yet, unlike me, can benefit from that preventative regimen. So that's a super fantastic deal, getting a free retinol with 2 products, and those 2 products are going to be products you want to buy anyway. So that's a fantastic deal. So hopefully you guys can take advantage of that. And if you have, I know a lot of people don't watch these live, so if you have questions as you're watching this later that we did not touch on, please send us a message and we will answer them. And then more importantly, if you want an individualized skincare evaluation and recommendation, make an appointment with Jennifer. She is fantastic. You will love her. She's very good at her job and very honest, and she will just give you her best recommendations to fit your time, your budget, and your allowable downtime. So please make an appointment with her. Anything else?
I think that's it.
Yeah. Okay. The other thing I wanted to mention, just to give a quick shout out, we're going to be doing another Facebook Live, educational Facebook Live tomorrow evening. I'm going to be giving that with my talented partner, Dr. McCatton, and we're going to be giving an update on what we know about the current state of breast implant safety, especially with some of the media buzz lately about a very rare entity called ALCL. So you'll want to tune in to that tomorrow evening. I think at 5 is when we're doing it. So we'll give you an update. And if you have any questions relating to that, again, feel free to ask us those questions and we will do our very best to answer them. Okay. Enjoy your lunch. Thanks for tuning in, guys.
Thank you.
Good.